Hello. So in today's video, I'm going to make a comparison between the skin and the lining of the gastrointestinal tract. So hold tight because I think what I have to say is going to blow your mind. For those of you meeting me for the first time, I'm Dr. Amina, a physician and a health coach. I help you lose weight by eating more. All right, so I was sort of thinking about embryology a bit. Embryology is a study of how we developed from the first cell and onwards. And so I was thinking about that and thinking about the fact that when the body develops, like when we're just like a cell or like a lump, and then as we develop and develop, essentially the gastrointestinal tract forms by an invagination. So think of it as a lump, and then there's like an invagination where like things get pushed in, and then this tunnel that forms within essentially is the gastrointestinal tract, which runs, of course, from mouth to anus. All right. So you can think of it as a sort of internal extension, like the gastrointestinal tract as an internal extension of the skin, the outer covering of the body. Now, for our skin, well, first of all, if we don't bathe, we're going to be able to know because the skin starts showing the effects of that, of the dirt and then the irritation. If we don't wash our hair, we have a buildup of flakes and secretions and so on and so forth. And then we start itching and again being irritated. And so it's kind of obvious if the external surfaces of our body don't get cleaned. We suffer the effects. If we put some sort of irritant lotion or any kind of chemical, people who work with chemicals, if there's some toxic or harsh irritant that touches the skin, we will be able to tell almost immediately, or at least at some point, if you do it repeatedly, have this topical irritant onto the skin, you will be able to tell because there'll be a rash or there'll be redness, inflammation, swelling, some indication that something is not right. Let's stop doing this. Most times, for the most part, at least if it's an immediate reaction, people will be able to tell, okay, I need to stop doing something about this, right? So externally, it's obvious. Now, internally in the gastrointestinal tract, well, for the mouth, that's easy because we actually can see what's going on in the mouth, and we know because it's accessible, we can brush our teeth and clean the gums and floss and things like that, brush the tongue and so on. So for the mouth, because that's an accessible part, we can take care of it so that there's no buildup of things that can be irritating, buildup of bacteria, buildup of plaque, food, etc. What happens within the gut then? So we have no access to that. So think about it. If we eat something that is irritating, if we eat something that we're allergic to, we might not be able to tell. The way the food is now, there are so many new additive chemicals in our food in recent decades because of processing and bulk manufacturing of food. So there are a lot of new substances, chemicals, etc. that our bodies are being exposed to. And if we pause and ask ourselves, I wonder what's going on the inside, and we think about that, sticking onto the lining, causing irritation, causing swelling, but we might not necessarily have diarrhea, but there's just something that's not right. There's low level lingering inflammation, but because it's inside and we don't know exactly where it's coming from, we won't be able to tell what is going on. Now, the thing to prevent that, like by nature, because there's always going to be bad, like when there's good, there's bad. There's always bad with the good. But once we have the good outweighing the bad, then we should not have a problem. In this case, with eating our food, one of the good additives would be fiber, naturally occurring fiber, fruits, vegetables, legumes, nuts. All those things have fiber, and one of the most important jobs of fiber is essentially to propel potential irritants through the intestines, through the gut, and out. Trap those irritants in the mesh of fiber, and then they get passed out. In these modern times, especially in developed countries, North America, I'm living in North America, so I can talk about North America, the diet is extremely deficient in fiber. And so what happens if you're not having that bulk to propel the toxins out is that they can linger within the intestines for longer than normal. Elimination, the cycle of elimination should be no more than 24 hours, generally speaking. Okay, it can vary plus or minus, but generally speaking, we should be eliminated at least every 24 hours. And fiber helps to keep that elimination going. If you don't have fiber, so there's nothing to trap the potential irritants and toxins, and so they linger, they stay in the intestinal tract for longer, and so there's contact with these irritants to the intestinal wall. And then, because if depending on what you're sensitive to, and it's going to be very variable for different people, you can get inflammation. So whereas on your skin it's going to be obvious, you're going to get a rash, you're going to get redness or swelling, because it's on the inside, you're not going to know. And so you can have this mild, lingering, smoldering inflammation within the intestinal tract, anywhere from above to all the way down to the end of it, and you would never know. And so if you think to yourself, whenever you're deciding what you're going to eat, I wonder what this could do to my insides if it does not get passed out within 24 hours plus or minus. If you think about what could happen when you put irritants on your skin and compare potential irritants on the inside, that might help you to be a little more conscious about what you are eating, because you just can't tell. And then what would happen is that after years of this chronic, lingering, smoldering inflammation, you can have a multitude of diseases. Of course, colon cancer, gastrointestinal cancer is one, and it's known for a fact that gastrointestinal cancers are actually increasing. And it has been felt for a long time that it had to do with the lack, well, many reasons, but one of them has to do with lack of fiber. There's a condition which is also quite common, it's called diverticulosis, where you have these outpouchings in the intestinal wall, the colon, and those little pockets can actually get blocked, and then you can get infection and so on and so forth. It can be a surgical emergency. So these are all problems from sluggish elimination of the gastrointestinal tract. In addition to intestinal problems, there's more information coming out now that there are more distant problems, joint problems, inflammation, arthritis, and a whole host of other problems that may stem from gut inflammation. And so I did this video for y'all to just to make you think that, okay, if I'm eating this packet of cookies and it has carrageenan and it has food coloring and it has preservatives and then a lot of food, of course, has pesticides and so on. If I'm eating all these refined foods, which usually don't have fiber, it means that the additives are going to linger in my intestinal tract for longer than if I had fiber. What could be happening with this if I'm doing this day in, day out, month after month, year after year, decade after decade? It is not hard to think that there can be some repercussions in terms of chronic inflammation and general illness. So what to do about this? Just incorporate way more fiber in your diet. Like I said earlier, the diet is deficient in fiber for most people. And I mean, you should be getting at least 30 to 50 grams of fiber in your diet. Where are you going to get fiber from? Vegetables, of course, fruits, legumes, peas and beans are a very good source of fiber. Nuts, seeds, all these things are excellent sources of fiber. So yes, you can have whatever I guess you want every now and then. You don't want to be excessive, but you must have lots of fiber so that whatever potential toxins that you eat, because we're all going to take in toxins, it's just normal part of being alive in the world, but you want your body to be able to trap them and eliminate them so that they're not in prolonged contact with the gastrointestinal tract, the lining, and then to cause you disease. So I hope you all found this comparison, this analogy helpful, eye-opening, and that it will let you think and consider the potential complications, not to mention consequences of what it is that you are eating. If you like this video, share it with someone you know, give it a like, and I will see you on my next video. Bye.